During this video, we will discuss concepts that your healthcare team will continue to review with you as you prepare for surgery. This presentation will guide you through your heart surgery book. We will discuss the cardiac team, what to do if your condition changes, preparing for your surgery, possible complications, exercises and protecting your sternum, enhanced recovery after surgery, tools to guide your recovery.
The cardiac team. Here at St. Mary's General Hospital, your cardiac team will consist of a number of healthcare disciplines. They will include the Regional Cardiac Care Coordinator. The Cardiac Care Coordinator manages the details related to your surgical booking as you wait for your cardiac surgery. They are a contact for you, your family, and your doctor during the wait. They ensure you understand the plans for your cardiac surgery. Cardiac Surgeon. Your cardiac surgeon will meet with you before your surgery and perform the surgery. You will see them again 4 to 6 weeks after your surgery. Cardiac Anesthesiologist. The anesthesiologist will see you before your surgery and care for you in the operating room. They will keep you asleep, manage your blood pressure during surgery, and care for you in the cardiovascular intensive care unit, also known as the CVICU, directly after surgery. Registered First Assistant, also known as the RNFA. The First Assistant is a specially trained registered nurse working in the operating room. They will see you before your surgery to assess your limbs for removing the artery and/or vein and complete your skin preparation prior to surgery. Registered Nurse. Your registered nurse will care for you 24 hours a day while you're in hospital. They will support you to meet your goals for recovery and going home. Physiotherapist. Your physiotherapist will assist you to complete your required exercises, assess your mobility, and teach you to get in and out of bed with minimal discomfort. Nurse Practitioner. The nurse practitioner works closely with the surgeon and the rest of the cardiac team to coordinate and manage your care after surgery throughout your hospital stay. They will see you daily on the ward after you have had surgery. Multidisciplinary team. Depending on your needs, you may also see an occupational therapist, social worker, dietitian, pharmacist, respiratory therapist, or spiritual care.
What to do if your condition changes. If you are having angina more often or more severe than usual, it may signal a change in your heart disease. Contact your cardiologist or internist and they will contact the Regional Cardiac Care Coordinator at St. Mary's General Hospital. If you have unrelieved chest pain or shortness of breath, call 911 or have someone drive you to the nearest emergency department. Do not drive yourself. If you develop a cold with a fever, cough with phlegm, or any other type of infection, contact your family doctor and tell them that you are waiting for heart surgery. They will contact the Regional Cardiac Care Coordinator at St. Mary's General Hospital if needed. If you are injured in an accident, such as a fall, workplace injury, or car accident, you may need to be assessed and treated before your surgery. These injuries may or may not affect your surgical date. Be sure to see a doctor for your injuries. If you need to visit an emergency department or urgent care clinic, tell the staff you are waiting for heart surgery and request a report to be sent to the Regional Cardiac Coordinator at St. Mary's General Hospital.
Preparing for surgery. Family and friend support. Select one person to be the spokesperson for your family and loved ones. This will help to keep messages about your recovery consistent and allow staff to put their focus on caring for you after surgery. Your support network will be expected to be an active participant in your recovery in hospital and at home. Before surgery, discuss and identify who would be available and physically able to take on this role. The weeks and days before surgery. Follow the medication instructions given by the nurses in the pre-surgical clinic and refer to the medication list in the heart surgery booklet. Remove all jewelry, including wedding rings and intradermal or piercings, before arrival to the hospital. Remove all nail polish and artificial nails from your fingers and toes. Pack your belongings according to the heart surgery booklet. Stop shaving below your neck 2 weeks before your surgery. Men can and should only shave their neck and face. The night before surgery. Take a 15-minute shower. Do not eat after midnight. You may continue to drink water or apple juice during the night. Do not chew gum, eat hard candy, or smoke after midnight.
Day of surgery. The morning of surgery. Have another 15-minute shower, put on fresh clean clothes or a hospital gown after your shower. Do not wear makeup, perfume, lotion, or deodorant on the day of surgery. Wear your dentures, eyeglasses, and hearing aids as needed. These will be removed before surgery. Bring all protective cases for these items. Bring everything on the packing list, including your heart surgery book, medications, and your health card. After surgery, your family or support person may bring your belongings to CVICU. Do not bring valuables to the hospital. Arriving at the hospital. You may have your loved ones come with you on the day of surgery. Please arrive on time. When you arrive to the hospital, a volunteer will show you to the second floor day surgery admission area. You will be registered by a clerk. Please be sure to bring your health card with you. In day surgery, you will be shown to a stretcher area where you will change into a hospital gown. A nurse will come in to admit you, review your health history, medicines, and take your vital signs. The nurse will go over a pre-operative checklist with you. When the nurse is finished, the registered nurse first assist, or RNFA, will come in to speak to you. He or she will ask you more questions. If you require hair clipping before your surgery, the RNFA will complete this task. The RNFA will guide you through the body wipe skin preparation.
During your surgery. The surgery will usually take 4 to 6 hours, depending on the type of surgery you are having. Your family will wait in the intensive care waiting area on the second floor until your surgery is done. When your surgery is finished, your surgeon will visit your family in the same waiting area to give a report on how the surgery went. After surgery. You will be taken to the CVICU to recover from your surgery overnight. Your family will be allowed to visit for a short time before you wake up. They will get an update on how you are doing and the expected plan for your recovery while you are in the CVICU. Once appropriate, you will be transferred to 3 West, the inpatient cardiac surgery ward, where you will continue the rest of your recovery until you go home. The average length of stay after heart surgery is 4 to 5 days. You will stay in hospital until you can be safely discharged.
Incisions. You will have one or more of the following incisions: sternal incision, thoracic incision, arm incision, leg incision, chest tube incision. These incisions will be covered with a bandage for 2 days following your surgery. After the 2 days, if the incision is not draining, the bandage will be left off to help promote healing. Once you are able to, you should shower every day to keep your incisions clean and prevent infection. Your nurse will review how to shower safely after surgery. If you are not able to shower, your incisions should be cleaned daily by your nurse. General lines and tubes. After surgery, you will have a number of tubes and lines attached to you. These tubes and lines are used to closely monitor your condition. It is very important that you do not touch or pull any of these lines. They will be removed as you continue to improve in your recovery. After surgery, you will have tubes coming out of your lower chest. These are called chest tubes. They can be uncomfortable while they are in. However, these are necessary to remove fluid after surgery. Your healthcare team will remove them as soon as it is safe to do so. If you are experiencing pain above 3 out of 10, please ask your nurse for pain medication.
Possible complications after heart surgery. Next, we will discuss a few of the possible complications that you could experience during your recovery in the hospital that may extend your stay. Delirium. People who have had surgery are at risk for developing delirium during their recovery. Delirium is a temporary state of confusion. You will receive an On the Lookout for Delirium brochure. This brochure will help you to learn more about how delirium can affect someone after surgery and how it is treated. It also describes ways family members can help. Heart rhythm changes. After surgery, it is common to develop abnormal heart rhythms. This can include fast, slow, or irregular heartbeats. Some patients may feel unwell with this change in their heart rhythm. Others may not feel any change at all. The surgeon or nurse practitioner will be notified, and you will receive tests and medication as needed. You will be closely monitored during this time. Some patients' hearts may return to their normal rhythm. Some will continue to have this rhythm when they go home and will have follow-up. Fluid volume overload. During the operation and the first day of your recovery, you will be given fluid through your IV. This fluid is to help keep your blood pressure stable. It is also why you feel that your legs and feet are swollen after surgery. Your healthcare team will give you medication to help remove this extra fluid from your body.
Exercises are an important part of your recovery. Throughout your hospital stay, staff will teach you to complete breathing, arm, and leg exercises. These exercises are also safe for you to practice while you are waiting for surgery. The staff will also instruct you how to use the incentive spirometer. This is a deep breathing exercise that will help open up your airways and clear extra fluid from them after surgery. Step 1. Make a firm seal on the mouthpiece and take a deep breath inwards. Try not to shrug your shoulders. Step 2. Make sure you do not cover the holes at the bottom of the columns with your finger. Step 3. You will complete this exercise 10 times every hour while you are awake for the duration of your hospital stay. Step 4. Cough after every round of deep breathing. Practicing your deep breathing and coughing every hour while you recover will help open up your lungs and prevent complications such as pneumonia.
Protecting your sternum. You should continue to follow the instructions you receive in this video when getting in and out of bed or a chair. These instructions will ensure good sternal precautions. Your sternum is the large breastbone down the middle of your chest. If you have an incision here as part of your surgery, there are specific precautions you must follow to ensure that the breastbone under your incision heals well. The breastbone has been wired back together. These wires do not need to be removed, but they are only so strong. They can break if you strain them. This incision and the bone will need 3 months to heal completely. Moving around puts a lot of strain and pressure on this area. You will need to protect this area as it heals by following the sternal precautions you see on this video and in the heart surgery booklet. You should not lift, push, or pull anything weighing more than 5 to 10 pounds for 6 weeks. Do not forget that this includes your own body. Do not use your arms to push off the arms of a chair or bed to get up. Do not use your arms to push or pull on the railing of the stairs, and do not push or pull to open heavy doors. Hug your chest when coughing, laughing, or sneezing.
Getting out of bed. You should continue to follow the instructions you received in hospital when getting in and out of bed or a chair. These instructions will ensure good sternal precautions. Hug your pillow to your chest, move close to the edge of the bed, bend your knees up and roll over onto your side. Bring your legs over to the edge of the bed, push very slightly with the elbow that is against the bed to help you sit up. Use your legs to help you. Push them against the side of the bed as you sit up. Sit on the side of the bed and rest for at least 30 seconds to make sure that you are not dizzy. Stand up. Getting into bed. Hug your pillow to your chest. Stand squarely in front of the side of the bed and make sure you can feel the bed with the back of your legs. Lean forward, take a small bow, and lower yourself slowly onto the bed. Sit on the edge of the bed, lower your shoulder and head to the pillow while staying on your side. Lift one leg at a time into the bed. When both legs are in the bed, roll onto your back and position yourself straight in the bed. Getting up from a chair. Hug your pillow to your chest. Wiggle yourself forward with your hips to sit closer to the edge of the chair. Place your feet shoulder width apart with your knees bent before you stand. Rock forward 3 times, bringing your nose over your toes while counting to 3. Stand up using your legs on 3. Sitting down in a chair. Hug your pillow to your chest, stand squarely in front of the chair and make sure you can feel the chair with the back of your legs. Lean forward and take a small bow. Slowly lower yourself to sit on the chair.
Enhanced recovery after surgery. Our goal is for you to be able to return home to your loved ones. By working with your healthcare team and taking an active role in your surgery and recovery, you can heal faster, safer, and easier. At St. Mary's General Hospital, we focus on preventing 5 key elements that can slow your recovery after surgery. They are prevention of pain, prevention of nausea, prevention of constipation, prevention of immobility, and prevention of respiratory compromise. Prevention of pain. Pain is a different experience for each person. Use the 0 to 10 scale to assess your pain in hospital and after going home. 0 means you are pain-free. 10 means you are experiencing the worst pain you can imagine. You want to keep your pain rating at a 3 or less out of 10. Some pain after surgery is expected. We will work with you to keep your pain level well controlled. Having well-controlled pain will allow you to do your deep breathing and coughing and get up for your daily walks comfortably. Your role in prevention of pain. You can help prevent uncontrolled pain by telling your healthcare team if you currently use medications or herbal supplements for pain control or recreational use. Asking for pain medication when your pain is greater than 3 out of 10 and tracking your pain on your goal card. The healthcare team role in prevention of pain. Your healthcare team will support you in preventing uncontrolled pain by providing around-the-clock medication such as Tylenol. You will have stronger pain medication available for breakthrough pain. They will also provide pain medication before having any procedure. Prevention of nausea. Nausea is the feeling of being sick to your stomach. Some patients can feel nauseous after surgery for a number of reasons. Feelings of nausea can often lead to decreased appetite, decreased activity, and increased pain. Having well-controlled nausea will allow you to eat your meals to restore your energy and meet your activity goals. Your role in prevention of nausea. You can help prevent nausea by talking to your healthcare team about your dietary preferences. Tell your healthcare team if you are easily nauseated or are currently feeling nauseous. Track your nausea on your goal card. The healthcare team's role in prevention of nausea. Your healthcare team will support you in preventing nausea by providing you with appropriate food and providing you with medication to control your nausea. Prevention of constipation. After surgery, some patients may experience constipation. It is important that you work with your healthcare team to have your bowels return to normal within a few days after surgery. Your role in prevention of constipation. You can help prevent constipation by telling your healthcare team what you use to keep your bowel movements regular. For example, if you eat a diet high in fiber or use fiber supplements. After surgery, while you may not feel hungry, it is important that you continue to eat a heart-healthy diet and drink when you are thirsty during your recovery. Follow your activity goals on the My Journey home board. Track your bowel movements on your goal card. The healthcare team role in prevention of constipation. Your healthcare team will help to prevent constipation by giving you medication to keep your bowels moving after surgery, supporting you in meeting your activity goals, and encouraging you to stay well hydrated. Prevention of immobility. Immobility is not moving and walking around. Being active before you have your surgery is the best way to ensure that you will be able to follow the activity guidelines to help you in your recovery. Speak to your surgeon about what activity is safe for you to participate in while you wait for surgery. Your role in prevention of immobility. You can help prevent immobility after surgery by maintaining safe activity before surgery. Follow the activity goals identified by your healthcare team. If your pain is above 3 when you are up and walking or moving around, be sure to ask your nurse for pain medication. Track your activity on your goal card. The healthcare team role in prevention of immobility. Staff will help you to prevent immobility after surgery by supporting and encouraging you to become more and more independent in your walking, washing, and daily care as you recover. Prevention of respiratory compromise. Respiratory compromise is when you have difficulty breathing. Some patients will experience difficulty with their breathing after surgery. Your role in prevention of respiratory compromise. You can help prevent respiratory compromise by quitting smoking as early as possible before surgery. It is extremely important that you do not resume smoking after surgery. After surgery, you will be responsible for practicing your deep breathing and coughing and walking. If your pain is more than a 3 out of 10 when you are doing these things, be sure to ask your nurse for pain medication. Follow your activity on the My Journey home board. Track your incentive spirometry practice on your goals card. The healthcare team role in prevention of respiratory compromise. Your healthcare team will help to prevent respiratory compromise by providing you with smoking cessation tools and offering you access to the Smokers Helpline. They will check your oxygen levels, support your breathing exercises and activity goals on the My Journey home board. Your healthcare team will provide you with pain medication to keep you comfortable.
Tools to guide your recovery. My Journey home board. The My Journey home board is a tool that your healthcare team will use to identify members of your healthcare team, plan your upcoming discharge, and determine your daily plan in terms of breathing exercises, physical exercise, washing, and education. Provide a place for you and your family to ask questions. Act as a communication tool for staff about your recovery. My Goals card. You will take an active role in your recovery. The My Goals card is a tool that will help you track your daily progress and see how you are improving as you continue on your journey to recovery. This tool can be found at the back of your heart surgery book. You should keep this book with you and easily accessible during your recovery for reference. We look forward to supporting you throughout your surgery and recovery.